East Harlem is a vibrant, exciting multicultural community. But in 2006, we got a wake-up call.
The New York Times had an article which talked about the diabetes crisis in East Harlem.
We learned that diabetes strikes 1 in 12 adults in the U.S., but 1 in 6 in East Harlem.
East Harlem has the highest rate for morbidity, people dying, and certainly the highest rate for amputations.
Diabetes is a serious problem in the community. We all see the number of individuals that live in the community that are in wheelchairs, that have amputations, and if you approach them, the majority of them are going to tell you they're a diabetic.
I was devastated when I was first diagnosed, devastated. I was panic-stricken because I had memories, early memories of my grandmother who had diabetes and she had her leg amputated. It was just like, oh no, that can't happen to me.
My mom died of diabetes back in 2001, and it's a great loss in her family. She died.
Monday morning, I was so weak I had to call 911. And once I got to the hospital, they asked me, did I drink and all this other stuff, and I said no, and they wound up realizing that I was a diabetic. Shortly after that, my blood sugar was over 1,000. And I didn't know I was a diabetic. I didn't have any clue.
My interest in diabetes does come from a personal connection with my mother having had diabetes, who is deceased now, died at an early age because of complications resulting from diabetes being out of control.
We have serious cases of obesity within our school that are affecting our children.
I was over the limit of obese. Diabetes is something that is in the African American community. I'm a single mother, I have a child, I want to live long. I just want to be healthy just for myself.
So we got serious about the reasons we found ourselves at this crossroads.
We talk about obesity or diabetes. This cuts across socioeconomic lines, and we're seeing people from all backgrounds challenged by the American lifestyle, which says get something quick, get something that tastes good, but just isn't healthy for you.
We knew we had to do something, and the word went out through our friends and neighbors.
Lack of real education about food, what is healthy food. I think that it's a lot of myths out there of what's good to eat, what's not good to eat. And then of course the income factor. And the fact that, like most low-income communities, the food that is brought there is of lower quality.
The word went out in our schools.
I basically started looking at the population that I serve of children in middle school, and we started looking at the issues of obesity and what the children ate.
The word went out in our churches.
Diabetes is an issue which was personal for probably most of us in the room, in the sense that at least someone in our family was afflicted by diabetes.
And the word went out to our seniors.
I know a lot of the seniors do not eat properly, do not have no facts about nutrition, and I also knew that a lot of the stores in our neighborhood didn't supply healthy food, so I just wanted to take a step beyond.
I saw it happen to my mother,
My grandmother,
To my mother,
To my family,
and I did not want it to happen to my
community,
to my children.
And to me.
to me.
to me.
The community's Impact Diabetes Center helps to empower multicultural communities to prevent and control diabetes by creating healthier environments and mobilizing change with workshops, programs, and policies that are created for our community.
This workshop that will help people to learn the things they need to do in terms of eating healthy, being more physically active in their lives, and then make those changes that will help them to start to lose weight and to improve the quality of their health.
I saw in the clinic that I was going to over at Mount Sinai information about their program, and I started going right away.
My mother recently relocated to New York from Puerto Rico and has diabetes for a number of years, and when I realized how she shopped, I was very concerned. So I tried to encourage her, and I left a flyer of when certain classes were taking place.
This is our problem-solving session, and we just want you to keep this in mind. When a problem arises,
The Diabetes Self-Management Program helps those who already have diabetes to feel confident that they can make life changes.
My name is Kadeen D'Souza, and I'm a facilitator for the DSMP program, and that basically stands for Diabetes Self-Management Program.
That's right, yes, yes.
It's basically a workshop that goes on for 6 weeks that we offer for free for diabetics. And in this workshop, over the course of 6 weeks, we give them tools to become better self-managers and manage their diabetes, so overall they'll live healthier lives and just live longer. If you don't know how to test your blood glucose, ask your healthcare provider for help with a testing machine. Each week it's something different. Like the first week we go, basically, we introduce diabetes, what diabetes really is, what causes it. We tell the participants about the differences between high and low blood sugar, and just basically let them know how important it is for them to become active self-managers.
So here are some, I want to point over here, come over here to what to do when we are sick. The first is to test your blood every 4 or 5 hours. Even if you don't regularly do this, it's a good idea to do it when you are sick, because certain things affect your blood sugar when you are sick.
We really talk about healthy eating and how important it is to change the way they eat.
Portion control.
Restaurant etiquette.
Restaurant etiquette.
You can order a salad and have it dressing on the side.
We show people how to read food labels. We show them how to plan their plates.
Bueno, uno de las áreas que se discute en currículo es cómo leer las etiquetas, ¿no? De alimentos cuando uno va al supermercado. El concepto de las medidas, las cantidades, las porciones, la sal, ciertos términos que se utilizan, sodio, azúcar, distintos términos que a veces la gente no entiende que es azúcar en adición de azúcar. So, ese entender a cómo leer la etiqueta es sumamente importante.
We talk about exercise and how much is enough. What we tell them is, if you don't use it, you lose it.
It's not so hard to put a little exercise in your routine, to walk a little bit more, to move a little bit more.
I want you to have a great time. Let's go! Union Settlement has been blessed with having so many seniors enjoy this kind of activities. And we have been blessed with having so many people who are willing to work with us. The New York City Parks Department, the Walk New York group, the Impact Diabetes group that has funded us for a couple of years.
Ready? Switch.
And Blue Cross Blue Shield has funded this instructor that is now providing services to us.
I live in the East Harlem community, and it's a pleasure to come back and give back to the people, to the seniors in the East Harlem community.
We have walked with all of these different entities that help us keep our seniors happy, healthy, living in East Harlem.
Wait till they tag you.
This right here helps them, and it's the medicine outside of the doctor's office.
Yeah, well, I'm planning on going to the gym, going to the pool.
So we tell them to, basically start where you are, gradually work your way up.
We learn problem solving. Remember that? Yes, we learned problem solving.
Graduation is always, pretty hard. In the beginning, I used to cry, but now I'm okay. They're given a certificate and a book, and they're just so elated. They just feel so good, because to them, they came in, not expecting much. and they're walking away with, you know, a certificate saying that I successfully participated in this, and a wealth of information.
I feel so great and so good that I feel like I really graduated from college. I finally completed. See, honey, I completed something.
And I found out so much when I went to those that seminar or training. It was just excellent. And just learning information every week that we went there, it was just amazing and life-changing for me. It was mentioned by the facilitators in the class that they were having peer training if anyone was interested. And so immediately I gave my name because I felt that I wanted to share the knowledge with anybody who was willing to learn. The bottom line is that I am managing the disease. The disease is not managing me.
Learning about diabetes is one part of managing it. Being physically active is another.
This specific site is under the guidance of the Impact Center for Diabetes. And so for those people who are suffering from diabetes, exercise is a big part of the fight.
LaShawn Patch, he's leading a number of dance classes that have helped a lot of folks start considering how they might become, more mobile in their daily life.
I'm diabetic, and since I'm coming here 6 weeks, I've lost 4 pounds.
My mother has diabetes, so I bring her once in a while, and it really has improved our health.
Me gusta mucho la clase porque nos ayuda a sentirnos bien.
While we're having fun, we are building better bodies and helping to fight so many illnesses that are prevalent in communities of color.
I'm so happy with this Zumba. I love it because I feel much better. For diabetic people, you need to exercise to keep your glucose level down.
My dad had diabetes, and I don't want that to happen to me. And I have a wonderful teacher who's going to help me prevent that happening to me.
My mom had diabetes, so I know I'm a candidate for it. And just the fact that I have the opportunity to not only exercise myself to help fight diabetes, I also have this wonderful opportunity to lead the women of the community.
LaShawn is the best teacher, mejor maestra que hay.
Everybody is welcome here and everybody learns because she's so good.
We just have a great time. Exercise and losing weight and getting stronger hearts and fighting all kinds of illnesses. So that's what this class is.
I can't see my life without it.
We're also learning how to prevent diabetes entirely.
My name is Donna Bond, and I'm a facilitator for the HEAT program. And HEAT stands for Help Educate to Eliminate Diabetes.
Last week, for some of you who weren't here, we talked about communication. When you're trying to change, what you're eating and the exercise.
HEAT is a program for people who could be at risk for diabetes.
P, plan ahead. A, avoid extras. C, choose widely, and K, keep your portions small.
En mi familia yo sabía que todos éramos como gorditos, subidos de peso, y yo pensaba que este programa podía ayudarme para hacer más saludable a mi familia y para mí misma también.
I was at a risk that I could have been early diabetes, but I was still on the regular, so I wanted to enroll myself in the program.
After signing up and being screened and taking the glucose test and realizing that I was pre-diabetic, and she sat down with me and she told me my results, I felt that I had to do something about it.
We concentrate on foods that people eat, people's favorite foods.
Cheese, mayonnaise, butter, creamy sauces, okay? They're the ones that add up all the fat and all the cholesterol, right? And all the calories.
We let them know that they don't have to give up what they eat, because what they learn from their culture, but just find different ways how to prepare their food.
They opened up a new supermarket around here that looks like that's on the order Whole Food. It's called Best something, Best Yet. No, but their vegetables are fresh. They look fresh.
Farmers markets are a great resource for healthy food too. And using Healthy Bucks makes getting fresh fruits and vegetables even more affordable.
We're really excited to see this here. The only thing we had was bodegas or the Chinese little supermarkets, but this is great because we see that it's fresh. We develop a rapport with the gentlemen that come, and we ask them for other items that we might need. Just like right now, I was asking for a leaf that we call culantro, and we do a recaito, and we were just swapping some ideas. So this is great, and they also give us different types of recipes. You know, I'm not a vegetable person, I'm learning. So they teach us, they give us ideas of what we could do, and that's great. We need more of this here.
I think it's great that they come to our neighborhood.
Now it's just fruits and vegetables. And after eating fruits and vegetables, you're feeling quite well, very at peace.
How can we eat healthier at other people's houses or when you go to parties? Have a little bit of everything, but just smaller portions.
Many of us, we grew up in cultures where we were told to eat everything off our plate, and we were always reminded about people being starving in other countries. So we grew up with that guilt about, you know, I have to eat everything on my plate. Also, the portion sizes were very huge. We all, you know, came to that conclusion that we ate more than we should have been eating.
El concepto de las porciones, bien interesante, porque particularmente en la comunidad nuestra, puertorriqueña, cubana, dominicana, hay las porciones. Si tú vas a mi casa, yo te voy a servir un plato bastante amplio de arroz, habichuela, carne, ensalada. Y si no comemos eso, pues hay que tener cuidado porque se nos pueden ofender, nuestra comunidad se puede ofender. Porque la idea de servir ciertas porciones tan pequeñas, nosotros las vemos como, ay, bendito, se van a morir de hambre, o qué tacaño que nos están dando ese poquitito de comida, pues es un concepto un poquito que no estamos acostumbrados. Así que eso va a requerir un poquito de persuasión, pero creo que es importante.
I can get a large salad, right, and eat half of it, and have one salad 2 times, stretch one meal into 2, so I'm controlling my portion, and at the same time I'm feeling full, and I don't find myself craving as much anymore.
There is a session that we do called Reading Food Labels. And I think it's a very powerful session because they realize that in reading their labels, they're now aware of what they're putting into their bodies, how many grams of sugar, how many calories, how much fat is in that product.
I learned that it really is important that I know how to read labels. And actually I find myself looking at labels on everything, even if I go into a restaurant now, if it's a fast food restaurant, I still look at that calorie count and, you know, look to see how many carbs I'm taking in and how much sugar.
Are you ready?
Yeah.
Here we go. Stand up with good posture.
We try to show that exercise doesn't have to be vigorous or you don't have to be out of breath.
Hold on to the chair and extend your leg forward, alternating left leg and then right.
Sentados, de pie, que uno puede estirarse y hacer distintos movimientos, caminar a la clase o distintas formas, la importancia de hacer ejercicio y cómo eso puede ayudar.
Imagine yourself walking along a peaceful old country road.
The workshop also teaches people how to reduce stress, which can lead to unhealthy behavior, like overeating and smoking.
You can cross an old gate.
So we do walking all the time, we walk all the time.
During the different sessions, what we do is gradually build up what they learn and show them that the little changes that they're making, it has such an impact on their lives in terms of preventing themselves from getting diabetes. So they realize that little changes add up to big, good stuff.
I can't eat like how I used to eat anymore.
So rather than a little bit of macaroni salad or potato salad, eliminate either the macaroni or eliminate the...
Que si uno lo hace poco a poco, no se siente que uno está haciendo grandes cambios y sin embargo sabemos que para la salud es un gran cambio.
One of the biggest benefits to me having this program is being aware of the dangers of getting diabetes, learning how to do things to prevent it, and it's also by me learning it'll benefit me and my family in ways that I can hopefully put them in a better health position, that they're not as at the risk as maybe I am now in the future when they grow up.
East Harlem restaurants are also helping our community to eat healthier with a campaign called Save Half for Later.
Welcome to Creole. How are you today? So good to see all of you again.
Thank you.
Well, you've been here dozens of times. You probably know the menus by heart by now. So if you're ready, I'll just go ahead and I'll take your orders for you. What would you like?
The chicken and rice with vegetables, the greens.
Chicken, rice, and greens. You got it.
Thank you. I'll have the same.
The same? Okay.
I'll have chicken and rice whole with the greens.
Chicken, rice, hold the greens.
And chicken and vegetables.
Chicken and vegetables. Vegetarian. Wonderful.
By the way, I wanted to ask, what is this Save Half for Later about?
Well, that's a campaign that we're doing here at Creole, where we have these containers. And you can put half of your food in the container now and save half for later. What it does, it helps with portion control and it's for healthier eating, healthier living.
Right.
So would you like to see a container?
Oh, yes, please.
Wonderful.
Buena idea para llevarte la mitad de la comida y comértela después. That's a good idea.
Para todos los restaurantes que van familias bilingües.
Yo que estoy en dieta.
Exacto.
Buena idea.
Well, here's the container.
Nice. Look, this is perfect. Look at this. Look.
Yes, it's very nice. Perfect.
Ladies,
okay,
here we go.
Thank you so much.
Okay.
Nice, so much.
Okay.
Thank you.
Very welcome.
These are really big portions. They are.
Perfect. Thank you.
But what about our kids? How do we make sure they don't become diabetes statistics?
I think the next move is to really ensure that our children hear this message. The best way to get the message through is by being a living example. When parents don't exhibit through their own lifestyle the kind of habits, the kind of changes that they want to see their young people make, then it's very difficult to expect change to happen.
Well, my kids had very good food. They don't know what it is really to eat canned food. I basically cook everything from scratch. And if I'm buying something, if it's too many names in the label, then I don't buy it, because I don't know what that is.
Smells so good. If you eat a lot of fruits, they can make you healthy, and I eat strawberries every day because it's good.
Community programs like Concrete Safaris teach kids to grow their own vegetables and learn how to cook what they harvest.
Spread it about. So I'm gonna open it up. You're gonna put it in from the outside, exactly. My goal is to bring health and wellness and outdoor activity as a lifestyle, not to constantly associate the lifestyle as a prevention mechanism.
It's taught me that plants are also living things. We can grow our own fruits and vegetables. It's the freshest ones you can get. And I'm still getting a lot of things from them. They teach us a lot.
What did you do to cook it, and what did you make? A lot of what we do in the winter is the cooking, and they're encouraging each other to eat healthier. The kids are also going home and bringing vegetables home, but they're also eating more fruits and vegetables.
It smells so good.
Okay, awesome. Okay, who is next?
We went through step by step to cook the pears.
If if they're not having fun, they're not enjoying it, they're not personally invested, then they're not going to keep coming back.
Kids empowered with knowledge about living healthy pass that message on to others.
When I came home and I told my son that I was a pre-diabetic, it was as if he was monitoring my food intake. And then I noticed now that when we go food shopping, he's encouraging me more to eat healthy now, because he's telling me, you know, Mom, you lost a lot of weight, continue to eat healthy.
It's about legacy. It's about passing on a legacy of well-being, of wellness, of health.
Boys and girls, today we're going to be learning about nutritional science, okay? Investigates the metabolic and physiological responses of the body to diet. Say it with me, body to diet.
Body to diet.
Good. Advances in the field of molecular biology, biochemistry, and
do the healthy dance. Do the healthy dance. Everybody do the healthy dance.
It's the healthy dance. We're turning it up, everybody.
Suana mikunga, suana timpa, para mi gente, vamos a gozar. There's a new thing out, gonna make you shout. Got rhythm, got beat, gonna move your feet. Water, salad, yogurt, and beans. That's the food that'll make you stay lean. Rock, swing, shake, sing. Dance, everybody to the healthy thing. Get up, everybody, and boogie to the beat. 5 girls, 2 guys, watch what you eat. There's a war going on out there. Everybody be aware. French fries you like to eat, but that's the food which will make you weak. Measure the food in the palm of your hands, and if it's not fried, do the healthy dance. 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 Soda, cookies, potato chips. This junk won't get you fit. Carrots, spinach, collard greens. Lift up my self-esteem. Donuts, thumbs down. Go into the farmer's market around town. Fruits and vegetables I need now. Speed it, make a loud sound. Dip the apples right around. In the yogurt sauce, if you want to be down. Do the healthy dance. Do the healthy dance. Do the healthy dance. Do the healthy dance. Diabetes is what you want to avoid. All you have to do is play some sport. Sugar and rice may sound nice, but an apple a day keep the doctor away.
Diabetes what? Diabetes, yeah. Diabetes is here, so be aware. Candies, chips, come on, be smart. Eating healthy is doing your part.
Vegetables make me feel so good. You should eat every day, does your body good. I can play double dutch and jump so high. Leap to a building, I can even fly. I can play basketball, jump so high. Leap to the hoop, I can even fly. Echa pa'lante, echa pa' acá. Pica, pica, abala, cha, cha, cha. Do the healthy dance. 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 Everybody do the healthy dance. 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 Everybody do the healthy dance. 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 Everybody do the healthy dance. 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 Everybody do the healthy dance. Healthy dance. Healthy dance.
By spreading the word that we are all part of a healthier future, we are changing ourselves, our kids, our seniors, and our community. The power of change is transformative.
Every time I go in to teach a workshop, it's amazing to see how, right from the first day, people start to make changes.
When you feel good about yourself and you feel good about your future, you can take on anything. I mean, you can conquer the world.
Diabetes can be prevented if they do the right thing.
Small changes can lead to big results, and that's the message that we want everyone to get.
I have the power
to eat better,
to keep active.
I see how diabetes plagues our community.
My community deserves to be diabetes-free and healthy.
We have the power to prevent diabetes.
I want to be around for my granddaughter.
I want to help my community
prevent diabetes.
We have the power to eat healthy.
You have the power.
Tú tienes el poder.
If we put our minds together, we can help fight diabetes.
I
have the power.
I have the power. You could get the power too. You've got the power to turn your life around.
I'm doing my part to prevent diabetes.
How about you?
Bye.